the average that most doctors say, and I will just give this for most adults, for every year you've had something, expect it to take at least a month to heal. So I know that might come as a shock, but think of it this way. Imagine that you have a hatchet or a machete. I have stupid analogies, but they work for me, so just hang in there. I always imagine that somebody, before they ever have a symptom, they're standing outside of a forest, a real thick forest like the Amazon. And the moment they start having symptoms, they have that machete and they start hacking their way into the Amazon. Okay? When that patient comes to me, I have no idea where you're at. I don't know how far in you've gone. I don't know where you have gone. Okay? But the thing that the people have to remember is the moment that you realize that you're having symptoms and you come in my office, that's when you stop. You're no longer hacking your way into the forest. Now, when we start working with you, that's when you do an about face and you walk your way out of there. So here's the fun part. That path has already been cut for you. You already cut that path, right? So, and people can probably attest to this. If you've had something that's chronic and you started to actually feel better, guess what you typically run across on your way out? Similar symptoms that you had in your past. Because you're running out of where you just cut in.
That's mind-blowing.
And the fun part is, I'm not the one directing you. I'm not like, oh, here we come, we need to go make a left. That's your body.
Yeah.
Your body knows exactly where it went. So the part of the nervous system that knows what to do is called the autonomic nervous system. It runs things automatically. So since we've been sitting here, have you worried about your heartbeat? Have you worried about sweating? Can you make the hair on your arm stand up? No. It's things that we don't control, but they happen automatically. And so when you give the body what it's looking for, that autonomic nervous system says, ooh, I can now do something with this, and now I'm going to take us back to health. And that's the way you fall down is the way you get back up, is the easiest way to say it.
Yeah.
And so that's what I always tell patients to look for. Like if you run across a symptom you had 5 years ago or 10 years ago, please don't get discouraged. That's a good sign.